and to learn about the risks.
Yeah, heart disease has been the leading cause of death in the United States since 1950, according to the CDC. So today, we're sharing some tips to stay heart healthy in 2026 and beyond. And to help us do that, we have Dr. Harmony Reynolds, who joins us now. She is a cardiologist and the director of NYU's Center for Women's Cardiovascular Research. Dr. Reynolds, this is such an important topic. And my question is, at what age should we really become more cognizant of our heart health?
Oh, really, at any age, because heart disease is preventable and treatable, but it's best prevented when you have good health behaviors lifelong. So for me, it's important at any age.
What are some of the barometers? What are some of the benchmarks, things we should be tracking?
You want to know your numbers, and the most important numbers are blood pressure, blood cholesterol, blood sugar. Those are the ones that you're going to learn about from your doctor, although you can get blood pressure checked in a pharmacy. And then the numbers that you know yourself, the minutes that you exercised, your weight, how much you're sleeping.
You talk about how this is preventable and something that we can really be sort of taking a hold of our entire lives. What makes it preventable? Like, what should we be doing from 0 years old?
Oh, you want to eat healthy and make sure that you're getting enough exercise and enough sleep.
Okay, and what is enough sleep? Because last week we were talking about a study that came out and said people who are night owls, right, may actually have worse heart health than others. But is there, a particular time? Are we talking past 11 p.m. or does it depend on the individual?
I'm not sure there's a magic number, but for me, the number of hours of sleep is the most important thing. So I'd really like to see people getting 8 hours of sleep. Most people need 8 hours of sleep, but certainly at least get 7.
Okay, so if that comes at like 2 a.m. to 10 p.m. or 10 a.m., that's okay, 8 hours.
It's okay. It's better if it's a little bit earlier, and I'm not sure there's a magic bedtime. But it's most important to me that people get enough sleep to feel rested and to have lower stress.
From your vantage point, I mean, you have so many people coming into your office every single day. What is the most common myth that you hear?
I treat heart disease in women primarily, and so the biggest myth that I hear is that heart disease doesn't happen to women. Or it's a little bit of a myth that heart disease symptoms are completely different in women. People worry that they don't know what to look for because they know what heart disease symptoms are in men.
So what are they in women?
Well, it's very similar, actually, to men. They're on small percentage point differences. But in general, people think that heart symptoms would be so bad they couldn't stand it. And it doesn't usually work that way. So I guess that's a big myth that we
What
need
are
to
those,
dispel.
when you say they're so bad? Is it a heart palpitation? Is it feeling like a flutter? Like, give us
trouble breathing.
What does it look like?
It can be any of those things, but the most common heart symptom with a heart attack is going to be chest discomfort. And I say it's chest pain, but it might not be painful and it might not be exactly in your chest. So it can be in the jaw, neck, shoulders, arms, chest, back, upper stomach. And it might not be painful exactly. It might be just something that's uncomfortable, pressure, fullness, something that isn't really familiar to you in general.
In general, when you are going to see your doctor, ideally once a year, if you have a family history of heart disease, what types of additional questions might you want to ask?
You might ask about additional cholesterol markers. There's a cholesterol marker called lipoprotein A that sometimes runs in families, but the traditional risk factors run in families too. Blood pressure, blood sugar, blood cholesterol.
It's really important that we know and are aware, as you said, for any age.
Yeah, absolutely. All right, we really appreciate it. Dr. Harmony Reynolds, thank you so much for joining us here.
And to our viewers, stay right here. Much more news ahead. You're watching NBC News Daily.